Getting a full night's sleep is a real battle for millions of Americans because of sleep apnea, but it doesn't have to be. Sleep apnea is treatable and the treatment options are evolving. So this morning we have Dr. James Ludwick of West Houston ENT Sleep Center here to tell us about some new alternatives to those traditional CPAP machines because they can be uncomfortable.
Yeah, a bit cumbersome.
People don't like them, right? So you've brought in a device that you've been using at your business, and you say that the way to test for this device is new now.
Right, yeah. Oral appliances aren't new, but what is new is the ability to predict figure out who's a good candidate for an oral appliance. So,
Gotcha. So what do you do with that there?
Okay, so the idea of an oral appliance is, we're trying to make more room in the throat because that's the problem with sleep apnea is that your throat, relaxes when you sleep and collapses. So one of the ways to do that is if we could move your jaw forward a little bit, then all your tongue and all those other muscles are attached to your jaw. They're gonna follow. So what the device does is kind of like a night guard for like teeth grinding, except it has a couple flanges on it, and it just slides the jaw a few millimeters forward, and that gives you a few millimeters more space in your throat. Keeps your throat open, so it helps treat the problem.
And you'll actually monitor a patient overnight to see if this is a device that will work for them.
Yeah, so what's really neat right now is this company, SomnoMed, came out with a process called the Matrix. And the Matrix is a process where when you sleep in the lab, now we can actually remotely move your jaw while you sleep without having to wake the patient up to figure out if you're actually a good candidate. So we're not just guessing. Right now when dentists who usually make these appliances make them, they kind of are just guessing, try it, see if it works, and there's really no objective information. But this way we can objectively say, yes, you are benefiting from it, and then give you the appliance.
Wow, that's fascinating. And who's a good candidate for this? Is it somebody with severe sleep apnea or more mild?
Well, generally it's for people who obstruct about every 2 to 4 minutes, which would give you an average of every 15 to 30 times an hour. Yeah, if you're obstructing like every minute or 30 seconds, probably moving your jaw 3 millimeters or 4 millimeters isn't going to fix the problem. But most people are mild or moderate, so actually for a lot of patients it's a good option.
And what kind of results are you seeing in patients?
So generally you can expect about a 70 to 80% reduction in your events or obstructions, and that means you're going to get a lot less sleep fragmentation and feel a lot better the next day.
Well, this is certainly a timely topic because it is Heart Month, and if left untreated, sleep apnea can lead to heart problems, right?
It's true. It does. It's an independent risk factor for heart attack and stroke, but I mean, honestly, people don't come in because they want to not have a heart attack in 20 years. They come in because they don't feel well or they snore or something like that. So mainly people treat it to feel better day to day, but you're right, it does cause a lot of cardiovascular complications.
So if people want to learn more about this device and how maybe they can get tested for it, what do they need to do?
Come see me would be great. We're actually the only facility currently in Houston that offers the Matrix. You can go to our website at www.westhoustonement.com or call us for an appointment. Okay,
and there are more treatment options coming out for this, it seems like, all the time because it's one of those issues that it just keeps evolving, but people need to speak up and get treated for it, right?
Yeah, there are a lot of options available, and that's the important thing to understand.
Okay, all right, Dr. James Ludwick, thanks so much for coming in. We appreciate it.